I'm Dr. Anita Krishnan, your airway allergy expert at Bangalore ENT Care Centre, Koramangala. What is allergen immunotherapy? Allergen immunotherapy is a treatment in which the immune system is taught to tolerate the allergens or the antigens in the environment which it has been reacting to. The first step in allergen immunotherapy is to do a skin prick test to identify what is the most important antigen in your set of proteins which is causing the problem. When we do a skin prick test, sometimes we may find that you're only sensitized to one type of antigen. This is called monosensitization. Means you may be sensitized only to dust mite. The pollen, animal dander, food, everything, all the tests will come negative. In this kind of patients, we treat only for house dust mite because that is antigen. So the first step, as I told you, is to identify the antigen. Once the antigen is identified, then there is a second history which is taken to understand if that test which has come positive on your skin or that antigen which has shown the reaction is actually the culprit which is causing the problem. This is a second sitting which the specialist will make with you to confirm that this indeed is your problem. If you have become positive to multiple set of antigens, the specialist will ask you the right questions and you will have a discussion to identify which all antigens need to be desensitized for you. Now, allergen immunotherapy is administered in two ways. One is called SCIT or Subcutaneous Immunotherapy, SCIT. The other is called SLIT or Sublingual Immunotherapy. Both are kind of vaccines. One is administered in injections in the subcutaneous plane. It has to be done every 2 weeks in most of the routines which we follow. The advantage of SCIT is that it finishes in 1.5 years. But negative point is that it's administered by the doctor in the hospital. Sometimes it can cause anaphylactic reactions. In sublingual immunotherapy or SLIT, the medication is given to you and you will administer it under the tongue in the sublingual space every day in the morning. This is easier and safer because it is done at home. Now, SLIT takes a little longer duration. The suggested or recommended duration is 3 to 5 years universally. Sublingual immunotherapy has all these advantages. It is needle-free, it is safe, it is easier for busy adults who don't have the time to come to the clinic. You administer it at your home. Because of this, many specialists, including myself, prefer sublingual immunotherapy. The most important point is that allergen immunotherapy is the only treatment which can modify the course of the disease. Pharmacotherapy can only suppress your symptoms. Starting early, especially in younger patients, actually brings in a lot of relief and is almost curative. Thank you for watching.